Hello, this is Dr. Himanshu Trivedi. As I have said earlier, there have been complaints that there have been problems with my voice. So, as a result, I'm trying to repeat some of the topics that we had done before. I've repeated hypertension. Today, I'm going to repeat diabetes. Diabetes, basically, what diabetes is, like the sugar is high. Sugar is more than normal. Fasting blood sugar usually should be less than 100 pp2bs means sugar after checking sugar 2 hours after eating should be less than 140. Why one consumes sugar? Because it is the source of energy, right? We need energy in day to day functioning. As a result, glucose needs to be well controlled. Insulin is the hormone which is secreted by the pancreas, and it is the one which controls the sugar. Whenever we eat, glucose level goes up, insulin gets secreted from the pancreas, and it brings the sugar level down. There are many types of diabetes, but basically one can divide it into type 1 and type 2 diabetes. Type 1 usually is seen in children. Many times it is since birth, or it is just seen in very early years of life. Here, insulin is a must. Please remember, any patient with type 1 diabetes, you cannot stop insulin. Yes, at times person has vomiting, diarrhea, is not able to eat, one can hold insulin, but one cannot stop insulin. Then there is type 2, which usually occurs in people in the older ages, age greater than 40 or 45. Right here also, same thing, principle is the same. One needs to control the sugar, fasting less than 100, after food less than 140. There is a third test which we also use, which is known as hemoglobin A1C. Again, hemoglobin A1C. It tells about us about the average of last 3 months. It depends on the RBC, red blood cells, whose lifespan is 120 days. So roughly we get an idea about 3 to 4 months of sugar average sugar level by doing this test, hemoglobin A1C. Risk factors of diabetes, as I said, age, obesity, strong family history, father, mother having diabetes, or brother or sister. It also goes with high blood pressure and lack of exercise. There are symptoms of diabetes. There are three polys: polyuria, polydipsia, and polyphagia. Polyuria means a lot of sugar coming out in the urine. Frequency of the urine has gone up. Polydipsia means the person is thirsty a lot. Even after drinking water, he feels thirsty. And polyphagia means eating more food. So again, in short, eating too much of food, going to the bathroom a lot, and feeling a lot of thirst. These are the three major symptoms. Then other symptoms are blurring of vision, infections, repeated, like urinary tract infection, vaginitis in the female. In male, after a cut with the blade during shaving, the healing of the area is not occurring. Diagnosis, as I said, is very simple. Fasting blood sugar less than 100 pp2bs, less than 140. Hemoglobin A1C ideally should be less than 5.5. Between 5.5 and 6.5, people call it pre-diabetic. So one has to be careful. So the question comes in one's mind: why we should control the sugar? Because if you don't control the sugar, it will give you lot of complication. It will increase the risk of coronary artery disease. It will increase the risk of stroke. See, sugar affects the blood vessels. Blood vessels are almost everywhere in the body. So also it affects almost the whole body. As I have said earlier, if the doctor knows diabetes, he knows medicine. So diabetes is very devastating disease, causes lot of complications. As I said, coronary artery disease, stroke. It can also cause kidney failure. Eyes, it may cause retinopathy, cataracts. It can give tingling and numbness, particularly in the legs. Foot sensations may be gone. Patient may develop ulcer in the foot. A foreign body may get stuck in the foot because of lack of sensation. The person does not realize, and finally it ends up in an ulcer. So how to control it? Lifestyle changes. Eating healthy. One should eat a very balanced diet. Avoid overeating. In a plate, there should half plate should be vegetables, one fourth should be protein, and fourth should be whole grain. Half plate vegetables, one fourth protein, and one fourth whole grain. One should avoid sugar drinks, sweets, cakes, pastries, excessive rice and potatoes. One should prefer green vegetables, whole grain, pulses, fruits in some moderation. One should undergo good physical exercise, walking 30 minutes daily or at least 150 minutes per week. Healthy lifestyle is the foundation of diabetic treatment. Treatment. Treatment does not require medicines right away. First is diet, diet, diet. If diet fails and exercise is also not able to control your sugar, then you go for treatment. There are various treatments are available, oral as well as insulin. All this treatment should be taken under the guidance of a doctor. One thing I have noticed many times people start treatment with the doctor. Once the sugar comes under control, they stop it. No, the sugar is under control with the help of medicine. So stopping the medicine is not a very good idea. So it is very important that you take regular medical advice, get the sugars checked on a very regular basis. Get your targets clear. Fasting sugar should be less than 100. PP2 BAS should be less than 140, and hemoglobin A1C less than 5.5. Regular checkup, particularly of the eyes, foot, and the kidney. Thank you very much.